Today I'm going to be talking about 3 injuries that could possibly happen in water polo. The first injury is the sprain of the interphalangeal joints of the fingers. Symptoms of this injury could be pain and swelling of the joint, as well as severe point tenderness at the joint site, and instability of the finger at a lateral or medial position when it's in 150% flexion. Mechanisms of the injury is basically how this injury occurs, and that's by axial force producing a jammed finger. This causes the valgus or the varus to stress on the interphalangeal joint. 3 things that can be happening anatomically during this injury are a minor to complete tear of the collateral ligament, a volar plate tear, or a central extension or extensor tear. 2 methods of treatment for this injury is, if it's at an acute stage, is rest, ice, compression, and elevation. Also, you're going to want to get an x-ray and eventually have splinting done to this. If it's just a minor sprain, taping to the non-injured finger for support can be done. Carpal and metacarpal joint and anterior-posterior glides can help with mobility. The anterior portion of this glide, which is like this, helps in increasing flexion of the joint muscle, the metacarpal joint to be specific. The posterior part of this glide helps increase extension of the metacarpal joint. In order to get full benefits of this exercise, it should be done 3 times per day for 1 minute, 5 times a week. A natural progression for this exercise would be to do this 6 times per day, 5 days per week for 2 minutes. One of the other exercises that you could do is finger strengthening. This is essential for regaining normal function in your hand as well as in your fingers. What you could do is finger abduction with a rubber band. So you would want to do this 5 times every hour you're awake, 5 times a week. A natural progression for this would be to use a thicker rubber band 7 times every hour you're awake, 5 days a week. Another exercise for this injury would be fine motor function and control. One exercise for this is picking up coins. You could do this 5 times a day for 1 minute. A natural progression for this would be to pick up pens or pencils 5 times a day for 2 minutes. Scapular discus is another injury that could occur during water polo. So some of the symptoms of this would be the shoulder is held at a lower position than the other, as well as rotated forward almost in a slouching position. The inferior medial scapular makes the person appear to be slouched. What happens anatomically during this injury is the medial scapula will start to wing. Also, there will be coracoid tenderness, and the kinesis abnormalities become proficient in the scapula. Some of the mechanisms of injury could be repetitive overhead throw. Direct trauma and muscle strain could be another mechanism of injury. The method of treatment for this injury is stretching of the posterior shoulder capsule, pectoralis minor, coracoid brachialis, as well as the short head of the biceps. You can also strengthen the scapular stabilizers. Another treatment would be to rest for the throwing athletes until they are able to improve their scapular position. One of the exercises for this injury is to increase your flexibility. So what you're going to want to do is the posterior capsule stretch. You're going to want to cross over your body and just press in lightly, making sure that your scapula is being stretched out. So if you turn to the side, we can see the scapula being pushed out. You're going to want to do this 3 to 5 times a day for about 5 times a week. You're going to also want to hold this stretch during that time for about 30 seconds. A natural progression for this would be to increase the amount of time as well as the amount of times a day you would be doing this and the amount of times a week you would be doing this. So if you were going from 3 to 4 times a day, you would be going to 5 to 6 times. If you were doing 30 seconds holding, you would want to increase it to 45 seconds. Another exercise you could do is the doorway stretch. When you do this, you're going to want to have your arm at a 90-degree level, straight against the doorway handle, and then you're going to want... Another exercise would be the scapular elevation. This works the upper trapezius levitator scapula. In order to do this exercise, you would take 2 cans, each about 16 ounces. In order to do this, you're going to want to raise your shoulders up and down, up and down. You're going to want to do this about 10 times, 5 times throughout the day, and 5 times a week. A natural progression for this would be to go ahead and move up in weight, time, and rounds per day. So in order to do that, you're going to want to take either anything that weighs about 2 pounds. It could be a ball, a barbell, or a weighted object that weighs about 2 pounds. Again, you're going to want to raise your shoulders up and down. You're going to want to increase time as well doing this. So you're going to want to do this about 15 times a day with rounds of 15, done 6 times a week. I'm going to go ahead and slightly push out and then back in. As you're doing this, you're going to want to hold it for about 10 seconds. You're going to want to also do this 5 times a day, 5 days a week. You're going to want to do that 10 seconds through a rotation of 10 minutes. The 10 minutes can be broken up throughout the day. As a natural progression, you will want to hold this stretch for 20 seconds. Again, doing this for a total of 15 minutes throughout the day, 5 days a week. Our last and final injury would be shoulder dislocation, particularly in the anterior and inferior glenohumeral joint. The symptoms and signs of this is a flattened anterior deltoid muscle, acromion coracoid process would be prominent, and the head of the humerus may be seen posteriorly. Mechanisms of this injury may result from a direct impact of the posterior lateral aspect of the shoulder, as well as a forced abduction, external rotation, extension that forces the humeral head out of the glenoid cavity. What's happening anatomically during this injury is a number of things. There could be a torn capsular and ligament tissue, a possible tendinosis avulsion of the rotator cuff muscle, or of the long head of the bicep. Another possible injury would be the brachial plexus. And also there could be a profuse hemorrhage, possible tear or detachment of the glenoid labia. Method of treatment for this injury is the immediate immobilization, using either a sling with a folded towel or small pillow, completely holding your arm immobilized. Also, another method of treatment for this would be an immediate reduction by a physician to control the hemorrhage with ice cold packs. Another exercise that you could do for this type of injury is the scapular abduction of the medial trapezius. What you'll want to do is lay down on a flat surface and slowly lift your injured arm up to a 90-degree level and back down. And then up again to a 90-degree level and back down. You're going to want to do this 10 times in repetition, 10 times a day for 4 days a week. A natural progression for this would be to add weight and lengths of repetition. For a natural progression, you could use a soup can of 16 ounces and go all the way up 15 times in repetition, 10 times a day. Eventually, you will move on to heavier weights and more repetitions. Exercises for this injury include the Codeman's Circulum. This is done in a clockwise and counterclockwise motion. These circles should be done in 1-minute increments 5 times throughout the day, each for each rotation. This can be done 5 times a day and should be done 5 times a week. A natural progression for this would be to go ahead and grab a can measuring in 16 ounces again, going ahead and doing a counterclockwise and clockwise motion. Each motion should be done for 1 minute a day, 5 times a week, 5 times a day. Eventually, you will progress to longer times with longer weights. Exercise that you could do is a push into wall exercise. This is a plyometric exercise that should not be done until the later stage of rehabilitation. In order to do this exercise, you will want to take a step back away from the wall, enough to give you an angle. Then you are going to want to put both hands shoulder length apart right in front of you, up against the wall. Essentially what you are doing is a push-up. You're going to want to do this 5 times a day for 30 seconds, 4 times a week. A natural progression for this would be to do it 8 times a day for 45 seconds, 6 times a week.